Can quadriplegics move their arms? Quadriplegics, can quadriplegics move their arms? Quadriplegics, people often wonder, can quadriplegics move their arms? This answer may surprise you. The spinal cord at the neck of the body can be severely injured, causing a condition known as quadriplegia. Even though quadriplegics can move their hands, they are not able to grasp objects, or make any other motions that would allow them to be independent. Some people who have lost limb function are left with incomplete paralysis, in which their muscles are partially or fully controlled but not controlled. This condition is sometimes referred to as paresis. A spinal cord injury causes a person to become quadriplegic, but the brain and limbs of the individual remain functioning. The brain sends and receives signals through the spinal cord. The spine provides a connection between the body and brain, so the patient can move their arms and legs, and even use a wheelchair. Because of this, a quadriplegic has a compromised ability to communicate with his or her brain. Although quadriplegics can't move their arms, they can move their shoulders. This is possible due to a graft to the elbow that reproduces the function of the triceps muscle. This will help the patient to reach objects, transfer, propel their wheelchair, and perhaps return to driving. The goal is to give the patient as much independence as possible. When done properly, however, quadriplegics can return to driving. While quadriplegics still have their limbs, they don't have their arms and legs. The brain and spinal cord can be injured or damaged, causing the person to lose the ability to move their arms and legs. Symptomatic treatment will include physical therapy. If the symptoms persist, your doctor may prescribe a rehabilitation program. This will increase your chances of moving your arm and leg again. The underlying cause of quadriplegia is often caused by a severe spinal cord injury. Often, these quadriplegics can't regain the use of their limbs, but in some cases, surgery can help them to regain hand and arm movement. While it's a long process for patients, the results are amazing. It allows a quadriplegic to lead an independent life and can lead to a better quality of life. Quadriplegia is the condition that causes an individual to lose the ability to move their arms. It is caused by an injury to the cervical spinal cord. A quadriplegic is permanently paralyzed, but there is hope for recovery in mild cases. When the condition is caused by a brain injury, it can leave a person in a permanent vegetative state. But for many patients, recovery is possible, and it's important to have the correct diagnosis. Quadriplegia is a life-changing disability. Unfortunately, a severe spinal cord injury prevents people from recovering full use of their limbs. Fortunately, there are new treatments that can help a quadriplegic regain control of their arms and hands. If your family has a history of ALS, you have a better chance of getting the treatment you need. The Washington University School of Medicine can provide you with the information you need to make an informed decision about your condition. While paraplegics may not be able to move their arms, their brains and spinal cords are still intact. This means that their bodies will continue to function normally, but the brain will be unable to send signals to and from the limbs. Additionally, the loss of muscle function in the left arm will impact their ability to regulate their body temperature. They will be able to move their hands and legs with the help of a doctor. While it is not possible for quadriplegics to move their arms, it is possible for them to gain some function after a spinal cord injury. This type of rehabilitation focuses on compensatory mechanisms to make activities easier. Eventually, a patient can even walk again, but until then, there will always be limitations. Once a person has a spinal cord injury, they may never be able to learn to use their limbs. Functional quadriplegia, quadriplegics.